Okay, so welcome to today's 1 hour webinar training titled One Session Alcohol, Vaping, Marijuana, and Opioid Use Prevention, Introduction to Prevention plus Wellness. This 1 hour session is being recorded and it will be part of what we call, what we also call core knowledge for those prevention specialists and health professionals across the country and abroad who are going to be trained to become prevention plus wellness instructors or providers. So this session, as I said, is being recorded. At the end of today's session, I will send everyone a link to the recording. I'll send everyone a copy of a PDF of the slides. You're welcome to share those widely. Those of you that have registered and are on today, I'll also send you 1 hour CU certificate of completion for today's session. And we will have, take time, excuse me, at the end of today's session to open it up for your Q&A. So as we go along, if you have some questions, if there's something I'm discussing that doesn't make sense to you, it's not clear, please do send a note or type in a note in the live chat. The chat option here in your Zoom tool. It should be in your toolbar under the heading of More, M-O-R-E. Just point your cursor at those 3 horizontal dots and you'll see that chat option. So as we go along, if you have questions, you have comments, feel free to type those in and I'll look at those. We'll look at those together at the end of today's session. And address any concerns or questions you have. Remember, this is your time, so feel free to share with others what you're doing for discussion at the end of today's session. Questions you have, problems you're solving or struggling with as we all continue to have to perform this essential evidence-based prevention messaging for our youth and young adults in our communities, wherever we're at, during a pandemic. So extra challenges for everyone. Now, I know how challenging it is, and God bless you for all you do. And you are really the prevention heroes, making a difference in across the country and abroad. So thank you for joining us today from the East Coast, noon, West Coast, 9. Undoubtedly, we have some people from abroad as well. And for those of you that are taking this as a core knowledge session, thank you as well for being part of the Prevention Plus Wellness family. Today, we're going to address 4 critical objectives for this training. The first is we will be, and you will be, examining alcohol, vaping. Vaping refers to e-cigarettes, by the way. Cannabis and opioid use prevention plus wellness as PPW screening and brief interventions. That'll be the first focus. Secondly, you'll be able to list the differences between typical substance use prevention programs and what we consider rather, or I should say rather, very, I think, unique prevention plus wellness programs. So we'll compare and contrast typical and PPW prevention programs. Thirdly, you'll be able to explore theory as well as research, which supports both brief and multi-health risk behavior interventions. And then lastly, we will be describing various options, settings, and adaptations for both implementing and evaluating prevention plus wellness programs for those of you interested. I know we're at different stages depending on whether you've viewed some of our, excuse me, some of our earlier webinars, and some of you may be brand new to this. So again, we could even the playing ground, I guess, with Q&A afterwards. And so if you do have questions, you do have comments, feel free to type those in the chat option. Let's start with prevention plus wellness programs and the components. And we'll look first of all at our evidence-based sport prevention plus wellness programs for youth. This is an alcohol, primarily alcohol and other drug prevention intervention. It's evidence-based. That means from our perspective, it's been rigorously evaluated. Those outcomes have been published in scientific journals. And then lastly, the sport PPW program has been placed on evidence-based registries, NREP, Blueprints for Healthy Youth Development, and a whole bunch of others. I notice looking at some of these that sometimes This program is listed as sport prevention plus wellness, sometimes sport, sometimes prevention plus wellness sport. So if you're looking for it, you may have to look at those different variations of titles. And I do know it's a little confusing that we use the term sport when in fact it's really an alcohol drug prevention program. And it's for all youth, not just for youth. In athletics, for example, it is a universal prevention intervention. And the research shows that sport is effective in preventing alcohol, cigarettes, and marijuana among non-using universal population, as well as a substance using population, while increasing protective physical activity. As I said, sport PPW targets alcohol and other drug use and promotes physical activity, including sports, healthy nutrition, including breakfast, sleep, and stress control. Single session intervention, less than 50 minutes to complete it. It's a screening brief intervention. We have versions for high school, middle school, and elementary school. I apologize for the frog that I've got today. So it can be expanded. However, this is a common question. Well, if we have access to youth, more than one session, what do we do? The follow-up sessions, we discuss that during our 2-hour online program implementer training. And you have options and you have resources that we provide to extend your program if you want to do 2 sessions, 3 sessions, or more sessions with your youth. Even though as a screening and brief intervention, you can also provide it in just a single intervention with some effects lasting even a year after that single session. It comes with and is implemented with a PowerPoint slides. It comes with a manual that is scripted, and you can provide this sport PPW program to youth individually as well as in a group. It is based on a positive image marketing model, which we'll discuss more in shortly today. It has optional parent materials, a completely separate set of parent materials as a separate intervention. Let me just see if I can move my toolbar a little bit. It also includes a link to a digital download of all your reproducible materials. So once you have your program manual and you have your digital download link, which you copy to your computer for safekeeping, you get your PowerPoint slides in that link and all of the materials you need to implement your program to countless youth. No other purchase is needed, so it is a very cost-effective program. And we have, as of March, April, created protocols for providing your program, not just in person, but online to youth individually, in a group, in a combined in-person online setting, as well as by video and even telephone. Our parallel program to sport is called In Shape Prevention Plus Wellness, In Shape PPW. This program, unlike sport, which is for youth, high school, middle school, elementary school, In Shape PPW is for young adults. It's being implemented in college campuses, in communities, in the U.S. military, et cetera. Also evidence-based. In other words, rigorously evaluated, positive scientific outcomes published in refereed journal articles, then listed on evidence-based registries like NREP, like Blueprints for Healthy Youth Development, et cetera, shown to prevent alcohol use, including heavy alcohol use, marijuana use, including heavy marijuana use, increasing physical activity, sleep, other health-related quality of life, self-related quality of life among young adults, some effects even a year later. Like sport, In Shape focuses largely on alcohol, a little bit on tobacco, but the effects were broader than that. Like sport, effects were broader than that and included even marijuana effects. Targets alcohol, tobacco, physical activity, healthy nutrition, sleep, and stress control. Single session, a little bit longer, a little more content than sport. And it is a brief screening and intervention, which is considered an evidence-based practice. Screening brief intervention is an evidence-based practice. We'll discuss more of that today. It's implemented with slides. You get your manual. You can provide it to young adults individually and in a group. based on the same positive image communication marketing related theory, which we'll discuss today, called the behavior image model. Includes your reproducible materials in a digital download link, and online protocols are now included, and we discuss how to present your InShape PPW program online as well as in person. Now, then we have a number of what we call evidence-informed programs. All of these programs, all of these evidence-informed programs still use the evidence-based practices, screening, and brief intervention format. But these programs have not been fully rigorously evaluated yet, like Sport and InShape, but are adaptations or modifications of them. So Vaping PPW, for example, is a modification of the Sport program. It targets, rather than alcohol like Sport, it targets, as the name implies, e-cigarette use. So it's preventing e-cigarette use while promoting these protective wellness behaviors of physical activity, nutrition, breakfast, sleep, stress control. It also is a single session program. It can be expanded, like all of our programs, to multiple sessions rather easily. We discussed that during training. The Vaping PPW program is in a high school, middle school, and elementary school versions, also implemented with slides, also can be provided in person, one-on-one or in a group, as well as online, program manual, as well as a digital download. So that's Vaping PPW. We have a program very similar to that that's called Marijuana Prevention Plus Wellness, just like vaping, just like Sport, but obviously Marijuana PPW, the focus, the messaging is really about cannabis, how cannabis in all of its forms, smoking, vaping, eating, drinking, all of these forms, how using that as a young person interferes with those positive wellness behaviors and desired outcomes in images, and high school, middle school, elementary school version of the Marijuana PPW program. We also have an Opioid Prevention Plus Wellness program. And again, all of these programs use the same evidence-based practices, screening, and brief intervention format. Obviously, Opioid PPW, the focus is on preventing opioid misuse, preventing opioid use disorder. But this program is actually fashioned after the InShape program, focuses on different types of physical activity, healthy nutrition, sleep, and stress control. And we have versions for adolescents, as well as high-risk young men and high-risk young women, which is what SAMHSA identified as high-risk populations for opioid misuse. SAMHSA being the Substance Abuse Mental Health Services Administration. So Opioid PPW, very unique program, and very excited about that. Then we have other Prevention Plus Wellness programs that are worth noting. Here we have our only multi-session program, Sport 2 PPW, 6 sessions, alcohol and drug use focus, but also again, promoting all those healthy behaviors. And whereas all of our other PPW programs integrate substance use prevention with healthy wellness behavior promotion, Sport 2 pulls them apart and discusses and has lessons just on separate protective wellness behaviors. So example, Sport 2 PPW has one lesson just dealing with nutrition, 3 lessons dealing with different types of physical activity, a lesson on weight control, and a lesson on stress management. Still screening, brief intervention, still integrating promoting of protective wellness behaviors with prevention of alcohol and drug use. That's Sport 2. In God's Image, our very unique single session faith-based program that promotes protective wellness behaviors, nutrition, sleep, physical activity, while at the same time aimed at preventing alcohol and drug use, and also promoting spiritual habits. So that's why we call it In God's Image, faith-based program. And then lastly, our most recent program, just created it a couple of weeks ago, very unique program, different than all of our others, Racial Justice PPW. We focus on racial justice because we do know research indicates that racial discrimination among adolescents is associated with a greater substance use, depression, school failure, etc. And so racial justice addresses racial discrimination, prevents that, designed to prevent that, while promoting anti-racism behaviors among young people. Great new program, Racial Justice, PPW. Now let's talk about how prevention plus wellness programs differ from typical substance use prevention programs. When you compare and contrast them, you'll get a sense of how they're like and unlike other evidence-based prevention programs. So left-hand column, typical substance use prevention programs, right-hand column, prevention plus wellness programs. So if you look at the left-hand column under number 1, typical prevention programs usually address one or more substance use behaviors. It can be focused on one behavior, like say alcohol or marijuana, or may address drug use in general. If you go look to the right, PPW programs address substance use behaviors too, one or more, and what we call CDR behaviors, which is chronic disease risk behaviors. So prevention plus wellness programs are integrated programs. They address not just the prevention of substance use, so critical among youth and young adults, but also addressing these other even more common chronic disease risks of physical inactivity, screen time, obesity, not eating breakfast, not eating enough fruits and vegetables, not getting adequate sleep, not controlling stress. That's a major difference between typical substance use programs and PPW programs. Number 2 to the left-hand column, typical substance use programs consist of multiple sessions, could be 6, 10, 15, more, a year, 2 years. To the right, PPW programs for the most part are a single session. They can be expanded beyond that, but very powerful, very brief, single session programs, very practical, can be provided in any setting, and particularly adaptable to online use because of their brevity. Looking to the left-hand column again, under typical prevention programs, they are usually 3, educational in nature, where if you look to the right, under PPW programs, they're more motivational. Screening and brief interventions are designed to be more motivational, designed to initiate and then maintain actual behavior change. That's why they're powerful. That's why they can be brief. There's a ton of literature, more literature supporting screening brief interventions than any other type of intervention from a behavioral perspective that we know of. So screening brief interventions focus on behaviors, focus on motivation, and that for that reason, they can be very brief and powerful. Lastly, looking to the left, in substance use prevention programs, typical programs address substance use risks, and the good ones address resistance skills. If you look to the right, PPW programs also address substance use risks, and also self-control or self-regulation skills, so critically needed for positive youth development, particularly among high-risk youth, and a focus on desired future images, which is very, very motivational for young people. Continuing on in the right-hand column, looking at number 5, PPW programs are unique, typically unique, these characteristics are unique to them versus any other kind of typical substance use prevention program. Starting with number 5, PPW programs promote habits that improve physical and mental health. Number 6, they include multi-behavior goal setting. I'm going to describe more of this in more depth as we go along today. Number 7, PPW programs use scripted content, which increases fidelity and ease of use, whether I implement it or you, whether we implement it today, next week, or next year. That the script, if we follow it, will ensure that it's the same program across user and across time. Number 8, PPW programs we promote tailoring when we discuss, when we provide training for you. We believe tailoring is essential in some settings, and we could show you how to do it very quickly and easily. And so tailoring, unlike many, maybe most evidence-based prevention programs, we believe tailoring in some settings with some populations is important because there are so many different unique aspects of different settings and populations. I'll discuss some examples of that. Number 9, PPW programs now include optional remote online implementation methods. Some prevention programs have also adopted those more recently. And lastly, number 10, we have built-in pre-post surveys and free analysis, which allows you to do an immediate assessment of your lesson, of your program. Pre-test, lesson, post-test, all convenient, one session, and you'll be able to see, perhaps for the first time as a prevention and health specialist, how you are doing, how your program is reacting for those youth who you are providing it to. So let's drill down a little bit and talk a little bit more about all of these unique aspects of prevention plus wellness programs, starting with how PPW programs address not just the avoidance of substance use, but also chronic disease risk behaviors. How does that happen? It happens by having prevention plus wellness programs address alcohol and other substance use by promoting avoidance of those, whether it be alcohol or e-cigarettes, cannabis or tobacco or opioids, etc. At the same time, PPW programs address obesity, screen time, physical inactivity at chronic disease risk associated with the development of future chronic diseases like heart disease, stroke, even osteoporosis, diabetes, etc. How do PPW programs address obesity, screen time, physical inactivity? By promoting physical activity and sports participation. And you can go down the list and see the rest, how PPW programs address environmental influences, unhealthy eating, lack of sleep, uncontrolled stress, and even number 7, promoting spirituality and anti-racism. That's, of course, in those two unique programs, In God's Image and Racial Justice, PPW. So PPW programs address not just substance use prevention, but also the prevention of many critical chronic disease risk factors among youth and young adults. This occurs through the use of the evidence-based practices screening and brief intervention model. It's a 3-step process for prevention plus wellness programs. The first step, as you can see here, you screen participants, usually using a paper and pencil copy of a screening survey. And that is designed to increase awareness among young people about their current health habits, substance use, but also these productive wellness habits, physical activity, nutrition, sleep, stress control. Secondly, you as a facilitator, as an instructor, teacher, provide feedback on each of those critical health behaviors using positive image messaging, following your script in your manual and your PowerPoint slides. And this is designed to increase motivation for change. How does that happen? You're using positive image communications and these image evoking terms like fit, athletic, healthy, successful. That increases or cues or triggers unconscious images that young people have in their mind of themselves in the future, being more fit, active, healthy, and of their peers, and that increases motivation to engage in those behaviors. And of course, you also discuss how substance use interferes with or harms those behaviors, those benefits, and those images associated with the wellness behaviors. And thirdly, you assist participants to both set and monitor goals, not just to avoid substance use, but to engage in one or more protective, healthy behaviors. This increases self-regulation skills, self-control skills, which youth so desperately lack. And this is the initiation of behavior change. And to the extent that you remind youth to continue this process every week, this will help them build actual and maintain actual behavior change over time. Those are the 3 steps: screening, feedback, and goal setting. Let's look at the evidence supporting screening and brief interventions in general. If you look at the left-hand block, there was a tremendous review of research that showed back in 2015 that showed that screening and brief interventions were effective even up to a year later with adolescents and young adults. And one of the other findings of that review of multiple studies was that brief interventions that included goal setting were even more effective, just like prevention plus wellness programs. That's why we believe that's a critical part, that third step, goal setting. On the right-hand block, in the right-hand block, you see that prevention plus wellness programs have had their own research looking at them. And we have two studies, in particular, one among adolescents, one among young adults, showing effects even lasting a year after a single prevention plus wellness lesson. So why do I continue to say that screening and brief interventions, or SBIs, are evidence-based practice? It's because these federal and international organizations and agencies have identified screening and brief intervention as evidence-based practice, starting with SAMHSA, the Substance Abuse Mental Health Services Administration. They have identified brief interventions as evidence-based practice, and even have their own evidence-based practices model called SBIRT, which refers to screening, brief intervention, and referral to treatment. Also, the CDC, Centers for Disease Control Prevention, have identified alcohol screening and brief intervention as evidence-based practice in primary care settings. And the World Health Organization, or WHO, supports alcohol screening and brief intervention. We can continue with NIAAA, the National Institute on Alcohol Abuse and Alcoholism, has identified alcohol screening and brief intervention for youth. They support that. The American Academy of Pediatrics supports SBIRT for youth. And NIDA, the National Institute on Drug Abuse, supports adolescent substance use screening for screening and brief interventions as well. All these agencies and more have identified screening and brief intervention as evidence-based practice. Now, let's look at the evidence supporting prevention plus wellness, screening and brief intervention. So we're looking a little bit more focused on screening and brief intervention. PBW is a screening and brief intervention model. We're going to do this by looking at the sport prevention plus wellness program, the peer refereed published research in these 4 journals. We could do the same thing with In Shape for the young adults, but to save time, we're just going to focus on sport, and sport conducted the research with young people. If you summarize the findings of all the published studies evaluating sport, this is what you can conclude: that the single session sport intervention significantly decreases alcohol use, initiation, quantity, frequency, even binge drinking and alcohol problems. Secondly, it increases significantly physical activity among participating youth. Third, we saw reductions in cigarette smoking, with some of those effects lasting even a year after that single session intervention. We also found that the single session sport PBW program reduced binge drinking, smoking, marijuana use, and increased physical activity among substance using youth. And it increased parent-youth communication, very important. Number 6, we did a study of 3 of the 4 flyers, which are included in sport PBW programs, and found that those parent flyers significantly reduced alcohol use, alcohol problems, marijuana use, and increased parent-youth communication about prevention issues. That's the flyers that are included, the parent flyers included in prevention programs. Lastly, I think this is one of the most important studies, because it's one of the more recent ones, where the sport program was translated into Turkish language and implemented as a part of a nursing study, controlled study, randomized study. Some youth got sport, and other youth did not. And this is a completely different culture, a completely different region of the world, and a completely different language. And still, a sport program was found to show the sport program in this randomized trial setting was shown to improve indices of physical activity, nutrition, sleep, and mental health among youth who receive sport, as compared to those who were randomly controlled to not receive it. So great effects, quantitative documented research outcomes from the sport program. But we also collect, and we include this in all prevention plus wellness programs, I think, we include a pre and a post test. And the post test also has opportunities for youth to write what they like best and least about the program. This qualitative data fills in the gaps and helps further understand the quantitative data on outcomes of PPW programs. And for example, these are just, you know, some of the actual written responses from youth. I think this was high school youth who were participating in, I think, a half a dozen high schools in California. These are actual comments from youth who received the single session prevention program, sport PPW program. And if you glance down, you can see how sport can affect different aspects of young people's lives, from alcohol and drug use to helping them increase motivation for change, to increasing their healthy behaviors like nutrition and exercise, to improving body image, increasing goal setting, and they enjoyed it. They enjoyed the program, which is unlike other other prevention programs. Young people, particularly older adolescents and young adults, might not like and have been found to not like typical prevention programs because they've heard those risk-based messages before. But PPW programs, again, focus on positive image, positive behaviors. And that's why youth and parents, providers, and even funding agencies particularly like these integrated prevention plus wellness programs. All of our evaluations, published evaluations, are listed on our website, preventionpluswellness.com, and that's under the tool heading, and you can find out more and read the results and look at actual papers evaluating the sport and the InShape prevention plus wellness programs. And as I said, both of these programs are listed on a number of evidence-based registries, and you can see some of the lists there. There's a whole bunch of others, including continually growing numbers of state-based registries. Now, let's take a look at prevention plus wellness and how it targets substance use risks and self-control skills. This is the content. This is based on the conceptual framework for all prevention plus wellness programs. It's called the Behavior Image Model. BIM, the Behavior Image Model, is a marketing-related theoretical roadmap. Anybody could use it. You could use it. I can use it to create your own brief programs that integrate substance use prevention with the promotion of wellness behaviors. There's two components to this process and this model, behavior image model. The first assumption is that you can use positive images that will increase youth and young adult motivation for change. And then secondly, you can use multiple behavior goal setting to increase youth and young adult self-control or self-regulation skills. Let's look a little bit more at this. Prevention plus wellness programs address a number of substance use risks depending on the program. So for example, many of our programs, all of our programs, I would say, address substance use as a barrier to each of the targeted wellness behaviors. In other words, how does alcohol or cannabis or e-cigarettes or opioids or tobacco or other drugs interfere with and serve as a barrier and counterproductive to engaging in regular physical activity and feeling fit and active and healthy nutrition, sleep, stress control, etc. Also, other substance use risks addressed by prevention plus wellness programs includes the message that substance use harms your fitness and health. It causes life problems. Myths associated with substance use. I think myths are even more important for some of these developing epidemics of substance use, meaning marijuana use and vaping e-cigarettes. Most youth do not use that substance at critical social norm messaging. Healthy alternatives to substance use, choose for yourself, plan ahead, And then recommendations for wellness, very unique to Prevention Plus Wellness program, because we're recommending, or you will recommend to your youth, not just avoiding substance use, but engaging in all of the protective wellness behaviors, getting adequate sleep, eating a regular breakfast, eating healthy foods, getting regular movement of the body, whether it's sports or physical activities, work or whatever, just getting the body movement, so very important, and even controlling daily stress. Now, how does this work? What does this look like? Let me show you some examples by actually looking at the slides, the actual slides in some of our programs. We'll start with a sample of the Sport Prevention Plus Wellness program messaging, and this is the high school version. So you can see by this slide how we're linking an active life, very positive image, and saying that an active life and alcohol don't mix. And then you have this other content, very positive content, alcohol and drugs hurts or harms these other things, relationships, sports, how you feel, energy level, etc. And you've got positive illustration there of a young person. So these slides will show illustrations of both genders, different ethnicities, young people very happy, healthy, engaged in wellness producing outcomes. Here's a message that addresses nutrition. And again, this is high school sport PPW program, alcohol and marijuana rob your body of vitamins and minerals, lead to weight gain, sap your energy needed for sports, physical activities, and life. And great illustration of happy, healthy young people eating healthy and socializing. Here's a great message about how alcohol, tobacco, drugs disrupt sound sleep and stops deep sleep patterns in order to maintain an active, high energy life. Very, very positive image evoking terms, active and high energy. And here's a generic message about life problems in general. Alcohol, drugs put you at risk for these. Embarrassment in front of friends, hurting, getting sick, getting into trouble with family, school, the law, etc. Let's take a look at a sample of messaging. This integrating messages with the vaping PPW program, but let's look at the elementary school version just to compare it to the high school sport program. Obviously, the illustrations are different. You got these beautiful young kids, younger kids running, happy and healthy. And you can see the message here about how the key to a fit and healthy mind and body, lots of physical activity, and staying away from e-cigarettes and regular cigarettes. That's for the young kids. Here's a message about nutrition. E-cigarettes use candy and fruit flavors that appeal to young people. Vaping can reduce your body's use of vitamins and minerals, and withdrawal symptoms can make it hard to eat healthy and to be active. And you might need to do a little instruction. What does withdrawal symptom mean for these younger kids? A little opportunity for adding a little extra content there. I love this slide. You're showing how the social norm message. Studies show that most kids do not use e-cigarettes. They're there, happy, healthy, laughing, screaming, and great colors. And also focusing on resistance skills. You can learn to develop those resistance skills to say no by practicing like any sport or any skill. And then to keep healthy brain and body, have more energy, look and feel good, do better in school and sports. All of those very, very important benefits for young people, some image related, some not. Stay away from using all e-cigarettes, and a great picture of young kids there together, happy and healthy. Let's take a look at a sample of marijuana PPW program. This is the middle school version. So now we're going back to a middle school, active life and marijuana don't mix. Alcohol, I should say, active life and marijuana don't mix. Marijuana can hurt your brain and lungs, and how well you do in sports and school. Here's a marijuana message related to nutrition. Leads to eating junk foods and weight gain, saps your drive to do well and spend time with family and friends. And again, a message about withdrawal symptoms, making it hard to eat healthy and to be active. Here's a great message about how cannabis sort of is like not getting sleep. Marijuana harms your ability to think clearly and leads to lower grades, just like a lack of sleep. Cannabis is linked to increasing depression, anxiety, drains your energy needed to live actively. And that's why sleep is so important, as well as avoiding marijuana use. And here's a generic message about marijuana use causing life problems. But spun a little bit differently from this perspective, by not using marijuana, you won't have to experience these things: getting into trouble with parents, police, friends, harming your brain, ability to learn, grades, lungs, physical fitness, and having a depression, perhaps having depression and becoming seriously anxious, as well as addicted. Lastly, let's take a look at some sample messaging from the opioid PPW program. This is the adolescent version. Notice, remember, we also have a young men and a young women version of the opioid PPW program. There's some great messaging here about non-medical opioid use can interfering with you being physically active and that lifestyle. And it lists how that can happen. Number one, causing drowsiness, mental fog, nausea, constipation, decreasing energy level. Great content linking how, again, opioid misuse can interfere with active living. And great picture of healthy, happy young people and to the right there. There's also discussion of opioid use and nutrition problems. Using opioids can cause nausea, constipation, making it difficult to eat, withdrawal symptoms, sapping your body of energy. Again, great content, great images, linking opioid use avoidance. But also the opioid PPW program is unique in that it does also focus on how a non-medical use of opioids can aggravate and even increase stress. How does this work? By increasing more worries, unhappiness, greater sensation of physical pain, compulsion to abuse other drugs, etc. And so we show this positive image of young people meditating. And also the opioid PPW program is unique in that it addresses, as recommended by SAMHSA, the necessary and needed use of medication-assisted treatment, or MAT. So we introduce young people to what MAT is all about, naltrexone, and so that's the opioid PPW program. Prevention plus wellness also addresses, in addition to those positive image messages, there addresses self-control skills. That's the other part of the behavior image model. Remember, the behavior image model has two parts: positive images, self-control. This is the self-control piece. We get at self-control by increasing goal setting, self-regulation skills to set and monitor behavior goals specifically. This includes avoiding specific substances, alcohol, opioids, marijuana, e-cigarettes, etc., as well as improving one or more healthy habits. And then lastly, a co-signing process, which research shows makes it a contract, makes it a public commitment, and that increases motivation for change. You could learn more about how PPW programs work from our website, preventionpluswellness.com, under the tools header section, and you'll be able to look at a logic model. PPW programs also address peer and desired future images. So let's look at specific imaging, what we're talking about here. We're using positive images versus negative images in all prevention plus wellness programs because they are supported conceptually or theoretically in research and in practice. Let's just take conceptually. There's a number of theories, behavioral health theories. One example is positive selves theory, that positive images in particular and images in general influence how young people and young adults make decisions. Secondly, there's plenty of research in a whole array of areas, including self-concept, prototype images, possible selves, and positive identity, that shows that young people use images, and particularly positive images, to make health decisions. Lastly, there's decades of use of positive images, appealing images in from a practical perspective, in marketing and in advertising by the world's biggest companies for decades to promote their programs, to sell their programs, to market their programs. Everything from beer and cigarettes to blue jeans and cars and clothing and everything practically. Take a look at the right image. You can see, are we having blank yet, fun yet, whatever. There's the Bud Light image, and you've got in the background, again, very desirable, positive, happy, healthy young people. And they're selling beer. Prevention Plus Wellness is selling not a product, but a lifestyle, positive image, a desirable image, lifestyle, happy, healthy, productive lifestyle, using those image terms rather than the selling of a product. How does this work? Well, we are able to use the behavior image model to construct integrated multiple behavior messages. The goal of this messaging is to trigger a mental image of the young person of themselves in the future, or of the peers, and you do this by using positive image terms and illustrations. It's a two-step process. Step number one, you present positive desired images of themselves and of their peers and other benefits associated with particular wellness behavior. It could be nutrition, it could be breakfast, it could be regular physical activity, etc. And then second part of the message is you show how substance use behaviors are barriers to achieving those positive behaviors and images and outcomes. How does it work? Let's take a look at an example of a two-step messaging. First step, you focus on the positive images and other benefits of a health-enhancing behavior. Quote, young people who engage in regular physical activity tend to feel energetic, sleep better, and look more active, fit, and confident. So this is a very concise, powerful message. You've got the target audience, young people. You've got the wellness behavior, regular physical activity. You've got the positive image terms underlined, energetic, active, fit, and confident. And you've got even another benefit, sleeping better. So that's a very concise, powerful image. You match that along with the illustration to the right, a young woman exercising, aerobic exercise, probably in wintertime. And you've got a very, very powerful, succinct message. You're cueing positive images of the future, of themselves in the future, and of their peers engage in these wellness behavior, this being regular physical activity. The second part of the message is you show how risk behavior, substance use interferes with that behavior and image. Here's a quote: marijuana use can reduce your energy level needed to participate in regular exercise and achieve your fitness goals of being in shape, looking good, and feeling fit and active. So there you go. You've linked how marijuana use in particular could change out the other substances. Doesn't matter. Depends on what you want to address. And it depends on which PPW program you're using. In this case, marijuana is shown to really interfere not just with regular physical activity and exercise, the ability to do it, but also all of these very, very critical outcomes and benefits, including images. Let's now look at PPW and how it promotes habits to improve mental and physical health. Obviously, Prevention Plus Wellness programs, like other substance use programs, address the most common substance use risks, starting with alcohol, which 6 out of 10 high school students report having used sometime in their life. This is followed by vaping, with 4 out of 10 high school adolescents reporting they've used vaping. This is followed by more than 1 out of 3 using marijuana, then cigarettes, then opioids. So clearly, Prevention Plus Wellness programs address these substances as well as other substance use prevention programs, but PPW programs also address these chronic disease risk behaviors, which are even more prevalent among young people. This is youth risk behavior data. So you can see that 3 out of 4 youth are not getting at least 8 hours of sleep a night. 3 out of 4 are not getting the required amount of physical activity every day. 2 out of 3 are not eating a breakfast every day of the week. Less than 14% are even eating 3 vegetables a day. and you've got at least 1 in 5 watching 3 hours of television and other screen time, and that has increased with the pandemic, according to more recent research. This whole idea of multiple risks, where does it come from? There was a seminal study done in 2010 by Fox and colleagues that showed across the nation, over half of high school students were engaged in 2 or more risk behaviors at the same time. That's per youth as well as in groups of youth. That's why they recommended that interventions at the clinical, community, and we also say school level, should target multiple risks, because young people are experiencing multiple health risks, and that the relatedness, the interrelatedness of these risks should be discussed and addressed so that young people can understand. That's exactly what Prevention Plus Wellness programs do. They show how wellness behaviors interfere with substance use, protect against substance use, and how substance use interferes with protective wellness behaviors. Another more recent study, a longitudinal study across the nation, showed that multiple health risk behaviors are common among American adolescents. This was a study done by DeWinter and colleagues in 2016, with less than 5% meeting all 8 health behavior guidelines, and over 10% having 5 or more risk behaviors at the age of 16. This increased, I think, from 3 or 4% at age 13 to 10% at 16. It wasn't examined beyond that, but you could connect the dots. They're likely to increase the percentage of young people having a huge number, 5 out of 8 risk behaviors at 16. And the research showed that no fruit, veggie, and breakfast, overweight or obesity, physical inactivity, and smoking predicted other future risk behaviors. So some of these behaviors were predictive of other risk behaviors. The recommendation, prevention should target multiple risks. That's the trend and the pattern, both with the epidemiology of young people and the need for prevention that is more responsive to the reality that young people are not experiencing just one risk, even substance use risk, but other health risks. Another way to look at it is to look at the benefits of healthy lifestyle. Healthy lifestyle, research shows, is associated with less depression, anxiety, unsafe sex, as well as less alcohol, tobacco, and other substance use. That's critical to all of us as prevention and wellness specialists. But other research shows that healthy lifestyle, and this includes, again, being physically active, eating well, getting adequate sleep, is associated with improved mental and physical health and self-reported quality of life, more positive self-image, self-esteem, self-regulation, and life skills, greater brain development and cognitive functioning, more opportunities for making friends and socializing, greater academic success in terms of less suspensions, greater attendance in school, less dropouts, and more likelihood to attend and complete college. And then healthy lifestyle also associated with less chronic diseases like obesity and diabetes. Research, reviews of research, these are even more powerful because they look at a whole bunch of studies rather than a single study, but reviews of research have shown that multiple risk behavior programs are effective. So there was a study done in 2014 that showed that integrating prevention programs feasible and may be more effective than just single discrete programs. In other words, addressing one risk behavior at a time, like physical inactivity or vaping. There was a review of studies done in 2018 that showed that universal school-based multiple risk behavior interventions were effective in preventing tobacco, alcohol, illicit drug use, antisocial behavior, and improving physical activity. And then the most recent review in this area of multiple risk behavior program efficacy showed that these types of integrated programs decrease adolescent substance use, and that was associated with just one-time programs as well as multi-health consultations and group sessions. And then the recommendation from these authors, Simonton in 2018, was school-based interventions targeting multiple health behaviors may be effective and efficient way to decrease substance use. So if you address multiple health habits, you can have an impact on substance use prevention as well. Let's look at finally Prevention Plus Wellness Program implementation issues. I'm running a little bit late. I may be running a little bit late, so I'll just go through this quickly. PPW programs are unique in that they use scripted content. The pros are in the left-hand column. Scripted content means easy to use, less training time. In fact, our training is only 2 hours online, live. Increased fidelity and reliability of implementation, as I discussed earlier, and less skilled interventionists can provide our programs because they're scripted, including youth leaders. The cons are, or the negative side of scripted, is that it does require practice. It may feel a little stilted or unnatural at first until you practice them, and it does require the script to provide your program. Prevention Plus Wellness programs are being implemented. This is another implementation issue. PPW programs are being implemented in all 50 states and abroad in just about any setting where you could think of where there are young people or young adults. Schools, before and after school, you know, in these different settings, recreation clubs, PE, health, lunch, for high-risk youth that are in suspensions or facing suspension, boys and girls clubs, YMCA, peer leadership training, hospitals, clinics, you know, faith-based organizations, juvenile justice, homes, colleges, even the U.S. military is implementing Prevention Plus Wellness programs. There are 3 options if you decide to implement any PPW program. The first is you want to implement it as a standalone or as an add-on to other evidence-based prevention programs or other activities that you may be providing or instruction you may be providing at your site. Most, I would say most, training that I do throughout the country indicates that organizations typically will add Prevention Plus Wellness in addition to other prevention programs or other opportunities for physical activity, healthy nutrition, sleep, and that can be a very, very powerful added program addressing these positive images and positive behaviors, and yet still do some other prevention, treatment, intervention, education programs. Secondly, second option, you can implement your PPW program to youth individually, and that is to all youth, universal implementation, regular youth, as well as high-risk youth. Those may be with behavioral problems, those identified as already experimenting with substance use. But you could also implement PPW programs in a group. So there's a script to implement it to you in person, to youth individually in a group. And then lastly, you've got this option. Do you want to implement your program in person or online or in some kind of a combination of thereof, where you're implementing it in person to some youth, as well as streaming it live? All of those and more protocols are provided in all Prevention Plus Wellness programs, and we address all of that in our training, and including implementing by video and even by telephone. Since the initial creation of Sport and In Shape, we've created adaptations have emerged over the years, and we've been doing this for 11 years since initial development. And what we've created are programs that address other substance use behaviors and content, including vaping, marijuana, opioid PPW, and God's Image, Sport 2, racial justice PPW. We started implementing programs, universal prevention for all youth. Many organizations use all of our programs or our programs as selected or indicated programs for higher risk youth. We started with adolescents, and now we have programs for children, young adolescents, older adolescents, and young adults. Some organizations even use our programs for older adults. Our programs are now being implemented by youth leaders to their same age or younger age peers in many different settings, as I just described: recreation, sports, wilderness, juvenile justice, universal, U.S. military, We've created follow-up strategies. We've got resources on our website. We've got a second lesson in your prevention manual. Translations have occurred, including Turkish, and now protocols for implementing online, including by video and by phone. We offer 2-hour live online or sometimes webinar-based trainings for program implementers, as well as training trainers, and 1-hour youth leadership training to implement our PPW programs to their peers. And we have great built-in pre-post evaluation tools in all of our programs. It includes a scannable pre-test and post-test. This allows immediate pre-post program evaluation, which is so desperately needed among prevention providers to see how are they doing. Because if you do a good job, you're not going to see it. You prevented it by definition, but by collecting pre-post tests right there on the spot within your lesson, you can really practically assess program effects and where you may need to improve your program. We do this by including 2 measures of predictive of multiple behaviors, not just substance use behaviors, 5 substance uses, but also 4 wellness behaviors. And we provide a free basic analysis of these scanned surveys. And now we offer a link, an online version of the pre and post test. So if you provide your program online, you can drop the link in and collect your pre and post test right then and there during the lesson. Very, very practical. No data collected, no scanning. It's awesome. Very, very great time saver. So just to conclude, number 1, PPW programs address alcohol, e-cigarettes, marijuana, opioids, and other substance use, and chronic disease risks and other substance use risk factors for prevention. Number 2, numerous differences exist between PPW programs and other substance use prevention programs, which I think highlight the advantages of PPW programs for use, not just in person, but online. Number 3, theory, research, and practice supports the use of brief interventions, screening brief interventions, as well as multi-health prevention interventions, of which PPW is. And lastly, number 4, PPW programs have been adopted over the last 11 years and have been expanded for use to address different substances, different populations, levels of prevention, settings, implementation, even online. Want to learn more about PPW programs? Go to preventionpluswellness.com. There's a screenshot of our homepage. You can also go to find more information by looking at our online catalog. You could also request a sample, electronic sample of any of our programs. And by going to our website, preventionpluswellness.com, and dropping in your email address, you'll receive weekly email blasts informing you of free webinars and other resources that we provide, much of it under the tools heading, which are completely free. And then, of course, we have our programs and training for purchase. PreventionPlusWellness.com. You could call us at 904-472-5022. That's our phone number here in Jacksonville, excuse me, in St. Augustine, Florida. We just moved to St. Augustine a few weeks ago. Been living in Jacksonville for 30 years. Hard to break that habit. And you can email us at info@PreventionPlusWellness.com. Thank you for listening. My name is Dr. Chudley Wirch. I'm the president and founder at Prevention Plus Wellness, LLC, here in beautiful St. Augustine, Florida. So let's see if anyone has any questions or comments, and I'm happy to address those. And as I do that, I want to thank everybody once again for joining us and for all you do. God bless you for the work you do and making the difference among youth and young adults and families in your communities. If we can support you, help you, guide you, protect you, support you in any way, let us know how we can do that. Happy to do it, because it's an honor to work with all of you and all the wonderful prevention and health specialists throughout the country. Is there a correlation between introversion, cynicism? David, that's a great question. It's sort of beyond what we're focusing at the moment. I don't want to just discount what you're saying. but that could definitely be the case. Let me think about that some more. But I could just tell you this, it's likely that introversion, cynicism, some of these things can be associated with. What I would recommend is doing a good search of the published literature and see to what extent those are maybe risk factors for substance use. So thank you for that question. Another one by David is that, is there a correlation? Okay, it's the same one. It extended introversion, cynicism, maladaptive tendencies when it comes to drug use. Does one influence or as a result of another? That's a great question. Again, I would search the literature for that. I can't give you an answer just off the cuff. I'm not familiar with that. But I would say that it's likely that there is a relationship, and that could be a two-way relationship. It could be those factors influence substance use, and some substance use influences those risk factors, which is very common in the risk factor literature related to youth and substance use. Let's see. Thank you for saying hi. I like the updated slides. You are welcome. Will we get literature after the meeting? Yes, after this training, you will get a certificate for those of you that are viewing this live, and for 1 hour CEU, as well as a PDF of the slides and a link to this recorded session. This is not just a webinar that we provide, but it's also part of the training for program implementers. It's what we call core knowledge, really important overview of prevention plus wellness programs. Interesting, the marijuana PBW side about lifestyle was a bit misleading. Just because youth don't use marijuana does not mean they can't avoid depression. Yes, that's absolutely true. The way I read that, I think, was misleading, but not necessarily the slide. Definitely, marijuana is associated with those things, but certainly by avoiding marijuana doesn't mean that you'll avoid that. But the point is, and I think you'll understand this, that marijuana use, particularly frequent and heavy use, research shows is associated with these negative mental health outcomes, including depression and anxiety. My apologies for misrepresenting that or being unclear about that. Could you speak to that? Yes, I just did. Thank you for that and for being on top and keeping me honest on this. Great question. How do you respond to suggestions that integrated programs dilute the effectiveness of prevention programs, especially the ability to track outcomes? Well, I would say, again, go back to the literature. Look at what we just presented in terms of reviews. I think we presented 3 very solid reviews of research looking at integrated interventions, which showed just the opposite. Increased outcomes, greater effect sizes, broader behavioral change. So there is no real, I don't see how there's a problem with the ability to track outcomes. You're just tracking a broader number of outcomes. So for example, in our pre-post survey that we include in all of our programs, we're measuring we're including measures of, as I said earlier, 5 substances: alcohol, I think for the most part, alcohol, cigarettes, e-cigarettes, alcohol, e-cigarettes, cigarettes or tobacco, marijuana, and other illegal drugs, 5, and then 4 wellness behaviors: regular physical activity, healthy nutrition, sleep, and stress control. And that's done in a very brief 2-page assessment. So it can be done, and it really should be done. And really, again, I'm go back to the premise that we're saying, which is supported by plenty of research. Young people are experiencing multiple risk behaviors, and that there is good research showing that that young people need to understand how these behaviors are integrated and interrelate with each other, and reviews of research of interventions that address multiple health programs are effective. and achieving broad outcomes. Think about this as well. Think about the resources that are saved. Prevention has historically received very little of the substance use and health resources, from 1% to 3%, depending on what source you're looking at. And with that in mind, you can't afford to continue to just address one risk factor at a time. So you can address, let's say, and I'm not saying that there's not a need for that, but I'm saying you could spend your budget very quickly on programs addressing vaping and a program addressing marijuana, or you can address vaping and marijuana in addition to these other chronic disease risks, which are even more prevalent among young people. I hope I'm making the case for the importance of, again, multiple health behavior interventions, which are supported in research. Thank you for your presentation, very informative. Thank you for listening. Thank you, thank you. Great questions, very hard questions today, and I appreciate those and thought-provoking questions. Thank you all so much for what you do. I'm going to look one more time in the Q&A, make sure I didn't miss anything. Okay, I didn't miss anything. Thank you for participating. Have a great afternoon. Let me know if you need anything from us. Do check our website, preventionpluswellness.com. And I will tell you, all of you will receive an email from me. If you don't, check your spam folder, because it's likely been sent there because of the attachment of the certificate and the PDF of the slides. Have a great afternoon. Keep up the good work, everyone. Stay safe. Bye.